There are a lot of other questions beyond the use of MRD in the upfront setting and in the setting of patients that lose their MRD negativity and become MRD positive. So could we think of MRD as a potential strategy to even long-term stop maintenance therapy? A lot of patients are asking that. And the true answer is that we don't know. All the studies show that continued therapy seems to translate into the longest progression-free survival. And there are some limited pieces of information showing that overall survival is also superior. But we have to keep in mind that all patients are included in these analyses, both those that are MRD positive and MRD negative, and even those with a little bit more disease than that. So if we only focus on those that are MRD negative and follow them over time, and they had remained MRD negative while on maintenance for several years, could they safely be taken off? Or could they be taken off for maybe some years, and if they lose their MRD status, be put back again? So those are other questions for the future. No one knows the answer. The patients are asking us in clinic, and we say we don't know. We need to develop more studies.